assessment is not putting a child in a box, but it's open the path forward. I would say children's, they have a golden period. To invest in assessment is actually a long-term investment. Once you open, you make the first steps, it can be a very rewarding journey.
Welcome back to Be Kind to Your Mind. In this episode, we're talking about something that many parents think about but often struggle to take the first step on. Should I get my child assessed? Whether it's challenges with learning, behaviour, attention, or emotions, it can be hard to know when a child's struggles are something they'll grow out of or something that needs professional support. I'm joined today by Tan Ewin, clinical psychologist and clinical director at BrightStart Child and Adolescent Psychology. With years of working experience working with children, teens, and families, Ewin helps us unpack what a psychological assessment actually involves, when it's helpful, and what parents can expect from the process. We also talk about common signs that are easy to miss, the fears that many parents have about labeling their child, and how the right assessment can open the doors to real, meaningful support at home and in school. If you've ever had that gut feeling that your child is struggling but didn't know what to do next, this episode is for you. So, Ewin, welcome to the episode today. And before we get started into specific questions and content about psychological assessments for children, perhaps you could start with an introduction from yourself.
So I'm a clinical psychologist. So I'm specializing in children's and adolescent mental health. So currently I own a practice. So it's called BrightStart Child and Adolescent Psychology. So we provide services like assessment, parent coaching, interventions. And I guess the reasons why, I started this practice also ties very closely with my previous experience. So I was actually a director and also a head of school of a special needs center. So my role over there pretty much about, I work very closely with different allied health professionals like speech therapists, occupational therapists. We work very closely to help the child to close the gaps in terms of the developmental delay. So of course, I do provide assessments as well. I met with lots of parents who have come with different concerns. I supervise the teacher and the therapist there to provide the best, quality of services that actually meets the child needs. Because every child behaves differently and so on. And of course, throughout my years of experience, I realized that a lot of parents, they take a toll, a very long journey to think about whether my child should get assessed, whether my child really has a problems. I think that my gut feelings my child is something wrong with them, but maybe people around them saying that, you're just being overthinking and so on. So I guess the reason why is, I started this center. Part of the reasons also would like to provide, the guidance and the hopes for them to move forward, how to help the child further.
Thank you for your introduction and personal disclosure as well. I'm also working with you in that center, but knowing that I am inexperienced with children, I am merely providing support in terms of the business functions and not actually involved in the clinical work that you're doing with the clients. So for the audience back home, BrightStart is a center, but I am not personally involved in any of the clinical services. That is something that Ewin as well as some of our colleagues will be doing on a day-to-day basis. But knowing you personally, Ewin, you have already had experience with children and adolescents, especially being a part of a special needs early intervention center. Yeah. Yeah. But definitely you were in an environment where, for the most part, the children there have undergone some kind of psychological assessment to be placed in a more individualized kind of approach towards their development, educational, behavioral, and whatnot. Now, before we get into, I think, providing certain content related to how parents can make that informed decision on psychological assessments, we might want to first start off with defining what that is. So what is actually a psychological assessment and what is it used for?
I think that's a really good question. I think a lot of parents come in, they also don't really get it. Like, what is a psychological assessment? I mean, of course, I would say psychological assessment is not a single test. It's actually a process of gathering information about a child. So in order for us to make the decisions or to provide like recommendations and what would be the best step for the children to move forward. So imagine it's like, for example, today if you have like cough, like persistent cough, and then your whole body is very achy, or maybe started to have some mild fever, and you go to the GP, right? And then the GP will do some sort of screening, like hearing to your lung, your breathing, and at the same time asking for some information like whether are you currently on medications, whether do you have some family history of the similar diseases and so on. Then after the whole basic screening, and then it will say, okay, based on the symptoms that you described, or based on the very preliminary findings from the the screening, maybe 80% of it, okay, you might be having dengue. So, but I can't be prescribing you medications or treatments until I found out that, okay, it's really dengue. So you might need to go through the next step. For example, blood tests, and whatsoever. So same goes to the psychological assessment, I would say. So today, if you notice that, okay, my child seems to be a little bit different from other kids, right? It can be, it seems to be a bit more hyper, or they're slow in speaking, and it doesn't seem to be that responsive when I call them. And then these are all the signs and signals that, okay, probably I should go for a checkup. So, and that's how the assessment process begins. Yeah. So the moment you step inside the door, and then the whole thing. So we will talk about, again, gathering informations, background informations. We will do some basic screening, and we will advise the next step.
So the assessment happens on the part of the psychologist. The psychologist will observe behaviors of the child, will collect information from both the child and the parents, and potentially even other settings as well. So getting reports from the teachers that say, or reports from the daycare teachers or caregivers, in order to have all of the information to advise accordingly. And that is similar to the analogy about the doctor performing the initial assessment, right? So that is also called an assessment. But for the most part, it is a rather subjective or informal assessment. We know that, for example, a variety of concerns that typically happen in children, they may exhibit certain signs in terms of their behaviors or what happens at home or at school. And that informs us with regards to what can potentially be the next step. And going back to the analogy again with the blood test, in psychological assessments, we also have standardized assessments. We have IQ tests or any specific tests related to certain diagnosis that we can administer. And the reason why this provides objective results is because the result of the individual we assess can be compared to all individuals within the same age group as per the development of that particular test. So if the IQ test was developed, they would require statistical information about how people typically perform on these tests in order to have that comparison with the client that we are seeing and administering the test to. So all in all then, basically what to expect in the form of an assessment is when the parents and the child actually come for the session, assessment has already started, and maybe, potentially, there may be further tests that may be necessary if there are certain obvious signs or concerns based on the consultation that you have with the child and the parents initially.
Yes. So a lot of time I would say basic assessment, like the very first initial, what we call as consultations. I mean, depends on how parents, how they would like to phrase it. So a lot of time I would say the basic assessments or the consultations can tell us a lot of information. But of course, I do agree with you. There are a lot of times that it's a bit unfair. Like for example, based on the first session, it could be, maybe just a 30 minutes one-to-one direction for kids. And then it can be quite quick jump to conclusions that, okay, I think based on the symptoms shown, the child is having autism, for example. I mean, again, back to the analogy, right? It will be based on all the, basic examinations and the symptoms that the doctor observed or through the background information they gather from the parents. I would say maybe 80 to 85%, depends on our experience. You say, okay, I think the child is kind of, fulfill some of the symptoms of autism. But we cannot say for sure until we gather a little bit more information, which is usually the next step. And yes, we have a lot of standardized assessment. For example, yes, IQ test. So just IQ test alone, there are different types. So for example, we have the IQ test with C for the very young children one. So it tailors to the young children needs. So for example, I remember there's a part of test that it requires the child to respond. So we test the child processing speed. So instead of have to hold a pencil and start writing, which is usually for younger kids, like I would say before the preschool age, they might not be, have the ability to, the motor skill to write and so on. They actually use like a stamp, like a dabble. Yeah, and of course, the next stage would be the WIS, which is, I would say, the pretty common one for children populations all the way up to 16 and 70 years old. And of course, we have adult version as well. And some of the parents might concern, what if my child can't understand English? Because all the tests are standardized in English language. So, or what if my child not verbal? So, which a lot of children, for example, with delay, they might not be able to talk or to express themselves verbally. And of course, we also have another version, which is the non-verbal IQ test as well. And of course, there are some other tests that's very important to provide us a little bit more insight of a child emotional and behavioral challenges like CONUS. So CONUS is usually to assess ADHD. So a lot of the time we encourage parents, not they themselves just fill out the form, but also to get the input from a teacher as well. Yeah, because for a child with behavioral emotional challenges, a lot of time it shows across different settings. Yeah, it's very important for us to get the informations. And once we gather all the informations, and then we will compare the results to the child, a similar age peer. Because based on my experience, a lot of times the months matter. So for example, a child is, let's say, 7 years old, 2 months. And it's a little bit unfair we compare to a child like 7 years old, 11 months, for example. It's about a year gap. So I think the purpose of the standardized assessment also to, try to minimize the gap. So what they will do is they will compare like 7 years old, 2 months, we will compare to the 7 years old, 2 months populations. So it's a fair judgment and say, okay, comparatively, the child is actually perform, above or beyond or below. Yep.
Standardized assessments provide comparative scores in a more objective manner. And I think the initial consultation, whether or not we have quite a clear idea whether further assessment is necessary, it's going to be part of the client's characteristics as well. Some kids, I assume, are going to be very obviously showing certain signs where the ongoing or additional assessments that happen afterwards are more to confirm, right? So let's say the analogy of the doctor saying is dengue, based on experience and based on the signs and symptoms, very obviously is dengue. I need a blood test to confirm. But some children, as with adult clients that I typically see, may demonstrate signs and symptoms that are not very obvious. Or sometimes they may not be demonstrating any signs and symptoms, but parents are still concerned. So for those reasons, then the further assessments are going to be more of, adding to that layer of information as to whether or not it is to be ruled out, or whether or not initially from the consultation, certain signs or symptoms were not picked up as sensitively as we should. So then the objective results that we get from the assessments would really complement what's our next step. So I assume if you advise the parents that, based on what's been presented, there might be certain signs, you are not completely confident as well, but there can be value to the further assessment as well. Or sometimes parents just want to be completely sure and they will go ahead anyway with the further testing.
So, of course, based on my experience, a lot of parents, they might have the courageous to go for the first step, which is the basic consultation and everything. But a lot of time they will start to hesitate when, I think we need to go to the second steps in order to just be sure or to figure out, what could be, exactly done, to help with your child and so on. Of course, I'm hearing, some of the parents, the hesitation. So, for example, if I move on to the next step, would that be a possible label? Right. So, for example, I suspect a child could be, some behavioral, emotional challenges and so on. And then if I do the test, does that mean that my child is confirmed having ADHD or confirmed having autism? And if so, then what? Then is my child is going to be like that forever and so on? Also, a lot of times they are very scared about like labeling the child or how that the so-called label will limit the child. So I would say an assessment, right, is not about a test to pass or fail, right? Again, not necessarily that, based on my experience, a lot of the kids assessed, right, they might not necessarily end up with a diagnosis, but the conceptualizations, the results, and not just about the result from the objective measure, but also how the kids behave, how the kids being cooperative in the assessment itself. All this, I would say, it beyond the data. Yeah, so all this can actually provides valuable insights to the parents and the family. So a lot of time, what I advise the parents is, the necessity to do the test is not to just so-called diagnose or rule out certain diagnoses, but also to figure out what is the child's strength as well. A lot of time we can see the child as an isolated struggle. So for example, you come in and then you say, oh, my child learned very slow. Teacher complains that she couldn't pick up any concepts and she tend to zone out in the class and so on. So, but with the further assessment, for example, we can do some kind of achievement test, some standardized assessment. And then probably it turns out to be, okay, that's true that the kids perform comparatively lower than other people, that similar age peers. But at least we know, okay, the way how she do, maybe she kind of develops some kind of skill, or we can know the strength. So for example, from the IQ test, okay, she might be very weak in memory, for example, like auditory memory, but she can pick up very fast. She can memorize a lot of things through recognizing picture, for example. So that is her strength. All right, but a lot of time we say, oh yeah, my child is very forgetful, she cannot remember anything. But through a more objective measure, we can actually see a little bit more patterns. So okay, so now we can find out that, oh, actually the child is quite good in visual memory. So how shall we use her strength to cope with her weaknesses? And what kind of supports that we can give the child, so for her to, or for him to thrive in the, in the daily life. So not just school, but at home or social settings and so on.
What we've discussed so far is that a psychological assessment will involve consultation with the psychologist, and the psychologist is meant to screen through any symptoms, any signs, get a history to observe the child, and that provides quite good information. It may move to further assessments in the form of standardized assessments, where the goal is to have certain scores or certain measures of performance that is measured and compared to what is expected within that stage of development. With that information, then, what you're saying here is that on the one hand, yes, it is for the purpose of diagnosis. So we have certain diagnoses that is common in childhood. For example, diagnoses such as autism, spectrum disorder, ADHD, intellectual disability, and so on. But also at the same time, it's also to note down what could be the explanation of certain behaviors that the child is displaying. Or it could be also in terms of understanding what are the areas of improvements or the strengths of the child. And the overall goal then of the assessment is, on the one hand, yes, diagnosis, but on the other is really to understand the child quite comprehensively in order to provide the child with the right kind of support and environment for the child to be at their best self. And that typically happens at the end of the psychological report, which is typically provided to the parent, where the report will highlight the background information of the child, the results of the assessments, and then what can we make out of the results, how to explain the behaviors and so on, as well as with the aftercare recommendations or the after assessment recommendations. What can we done from here, knowing what we know, what's going to be best for the child. So it's not only a matter of diagnosis, what I'm trying to say here, which maybe for a lot of parents, when they are considering psychological assessments, they are thinking in that regard, is my child autistic or not? Does my child have ADHD? But a psychological assessment can go beyond the label.
Yes. And of course, I think one of the common questions that parents might struggle with is, when is the right time? right? So, for example, I noticed that my child is, like at the age of like 2 years old, like can't really speak a single word or don't know how to call like daddy, mommy, and so on. And sometimes parents might be, oh, okay, I think I need to get, my child assessed and so on. But people around them will say that, it's normal, especially in Asian culture, right? Like boys tend to talk slower. So just let the child grow naturally and eventually they will be able to speak. Yeah. So I think that is also comes to the questions that when is the right time for my child to be assessed? Because like what you mentioned earlier, not necessarily that we will move to the next step. A lot of times, even just a basic consultations, it can tell us a lot of information. So for example, I would say for me, my experience, I assess children as young as below 2 years old, if I'm not mistaken. Yeah, 1 year-ish, 1 year plus, and so on. Yeah. So sometimes parents come in and then they will be very emotionally distressed because like, they insist want the child to be assessed, but that the whole family saying that you're just being paranoid, you're just being over thinking, you are, if let's say, what if it turns out to be true, your child is like, having, some kind of delay and so on. And that means that you're limiting your child, right? So you will be overprotecting your child and so on. But I would say the earliest that you do the assessment, the earlier that you'll be able to get a better clarity of your child's struggle. I mean, of course, especially nowadays, MCO, there's a lot of MCO baby, right? They born during the MCO periods like 2019, 2020. Based on my experience, a lot of the kids, they struggle with some social issue and also speech delay as well because they have been, in a confined environment for maybe years and so on. Then maybe after like 2-3 years when the MCO lifted, then they start to go to school. They don't know how to behave socially and so on. I would say the earliest that you assess and then the earlier that we might not be able to have a diagnosis because it's too young, but at least we know, okay, then what can we do to support the family? So a lot of times, even though during the basic consultations, I will be able to give some tips for the parents to how they structure the environment. I always believe that my role as a clinical psychologist, I'm just an assessor, right? Of course, I am like a GPS, but eventually you are the one who have to drive the car, right? So my role here, of course, to help you to assess, to see things a little bit clearer or to put things all together. But parents is always the very important figure to help to carry the intervention forward. So I would say to the parents, like, don't hesitate to make the first step, right? Even though, your child is just a few months old or 1 year old, you just want to have like a chat with a psychologist. Just schedule a sessions, right? And then just to make things clearer and so on. I would say the earlier that we detect if there's any hidden problems and the earlier that we intervene, the high chance that the kids can close the gaps and can be functions pretty independently as compared to the normal child.
And I think that's also demonstrated in the literature. The earlier the intervention, the more effective it will be. And in this case, the intervention might mean, maybe that can be a question to you, because when we think, as psychologists, we think of interventions is oftentimes to perhaps correct certain problems and whatnot. But I think it goes beyond that. So maybe before we answer to that question, then what should parents look out for when they do want to consider coming in for a psychological assessment or a consultation for their child? What are the typical signs and maybe,
Of course, the common one would be, okay, for example, if the school complains that, your child can't pay attention in the class, like tend to interrupt other people or simply takes other people things, can be quite disruptive in the class or pretty hyper. So I guess these are some of the, I would say, common, especially when the kids go to school. And I would say quite a big class, right? These are the things that teacher quite likely to be spot on and then, give feedback to the parents. Like, your child doesn't seem to be, like normal or like very different from his other peers. I think these are usually the red flags. But of course, there are some other situations like, okay, so my child is like always throw tantrums. So the frequency is very high, the intensity is very bad. Because when we say intensity is very bad, as in it's not very age appropriate, like whenever they couldn't get things that they want, they roll on the floor, or they can be really uncontrollable by like biting, kicking, screaming, that parents might find it very hard to control. And if let's say this behavior is even, he can even like throw tantrums in front of the public, means it might show us that, the child is really going through a lot of emotional, these like big emotions, like what we say, that doesn't know how to manage even in front of the public. And of course, these are more, I would say, more like an externalizing problem, means it's pretty obvious that it shows outside. But of course, there are some other things that the kids might be behaving quite good. They try, they listen, they pay attention, they do all the homeworks and so on, but they struggle to follow through instructions. They might seem to be forgetful, not very responsive, like always, like looks like very blur, or socially isolated from other people. Because usually children are, they have social interests. They like to play with their peers. But if let's say you notice your child doesn't seem to be joined to the group, or sometimes teacher might share some pictures, and some parents will feedback to me that, I see the pictures, my child is not inside, and don't know where is my child, maybe it's at the side, or teacher put him at the sides and so on. Or it can be as simple as overly quiet. Yeah. So a lot of times I would say the children who is like so-called quiet and internalized problems, right? They are actually at a pretty disadvantaged place because they are not being disruptive. So I would say a lot of times in the class setting, teacher might find them easier to be managed. So they might put the child at the side. They will only focus more on, the child was like more hyper and the disruptives and so on. Yeah. So a lot of times I would say, trust your gut feeling. So a lot of time parents, like you say, you just as simple as, I look through the pictures that the teacher sent. Why my child is not inside, or my child doesn't seem to be happy in the picture. Yeah. So these are the things that tell something. Yeah. I would say definitely worth to check. It could be some hidden psychological problem, or there's some, it could be some bullying happen, but the child might not acquire the ability to express what's happening. Maybe they themselves also confused. Like, that is actually bullying, or that is actually criticism, for example. But of course, as for children who are at a very young age, then some of the things is including delay. So for example, delay in talking. This is pretty obvious, like eye contact. I call my child names for like 5 times, and then probably you only answer me like 1 time. Until age of like 2, still cannot call papa, mama, daddy, mommy, or even delay in play. So for children, we have different play stage. So for young children, like for example, infants or toddler, they might already can play on their own, like car, for example, play according to the functions like cow, you just drink, pretend play, and so on. But certain kids, maybe until like 4 years old, 5 years old, the way they play, either it can be very obsessive. So for example, I only like to play like certain types of things, like cars, for example. But I'm not playing according to the function, as in like I play like, there's a highway, we park my car and so on. But maybe put inside the mouth, or take out dismantle all the, parts and so on. Like the play that's not very usual. Yeah. So I think all these are red flags. Of course, adolescent, it can be a little bit more complicated because adolescent due to the development phase. So they're in between child and transitioning to adulthood. So of course, puberty, hormonal change, and they can be rebellious. And then they have friendship issue, romantic relationship issues. And for those who are, approaching like college age, they might be worried about their future, or I'm not sure what I want to study, academic stress. I would say children at different age, they have their own so-called struggle and problems. So of course, it's very important for parents to be paying a little bit more attention. Yeah, of course, some feedback from people around you can be very important. But of course, at the end, it goes back to you, parents, who spend the most time with the child. Yeah, always trust your gut feelings. If something's a bit off, then this is the time that you might just set up an appointment. Just check it out.
So a few things that you've mentioned here. Number one is with regards to feedback from their educational setting. So teachers have met a variety of students over a course of time, and they are able to observe if perhaps the child is adjusting to the environment or not. So one point of contact will always be teachers' feedback. They might be noticing something that isn't quite right, or noticing certain signs of concern and escalating that to the parents. So that can be one reason why a parent may consider booking a psychological consultation to have the child assessed. The second being if there is any certain signs that the parents might notice is something that is amiss about the child. And this one is going to be a little bit more subjective because when it comes to mental health concerns, there are a variety of different concerns that we are trained to assess for. So I think over here, the advice might not be very specific, but rather if the parents notice something, best to get assessed. And lastly, you've mentioned about developmental stages. And children have rapid development across a variety of different behaviors and cognitive development, emotional development. Sometimes in a matter of months, certain development may actually happen. And parents may notice that their child might not be exhibiting certain behaviors or certain intellectual development that is appropriate for the given age. So that also can be another reason why someone can be seeking a psychological assessment. Nevertheless, this all comes from a perspective where there isn't something that is quite right, or there's certain feedback that is concerning, and that's the reason why I would want to come for a session. Alternatively, all these are perhaps knowledge and expertise that someone in the field or someone who is trained to do this kind of work will be able to advise accordingly. So parents, a lot of times, I assume, may not be completely sure as well. It's not so much of a critical sign or that they're concerned or that there is any negative feedback, but it's because it's more of a question mark. They aren't sure whether the child is meeting certain developmental milestones. They're unsure if their child is adjusting to the environment or not. It's more coming from a place of curiosity rather than from a place of concern. And even that, I assume you're meeting parents who, might come in because they're curious rather than concerned. So they want to be advised as to, my child is 5 years old, what's the typical behaviors or typical things needs that a child would require at that age. And for that reason as well, they can actually consider psychological consultations because it's more about being more empowered with more knowledge rather than to want to assess for something that's lacking. Would you say that's a correct assumption to make about the services that we offer?
Yes. I would say a lot of times, right? I mean, of course, there's also one situations that encounter. I would say also not uncommon, as in parents will say, okay, I don't think my child will come. I don't think my child, understands the concept of kind for assessment. I'm not sure whether my child will cooperate, but I already run out of ways. I've tried multiple ways. I'm not sure what to do. And I'm clueless, right? I've been providing support. I've been giving everything. But why my child is not being satisfied, ask for more and so on. I mean, of course, sometimes parents will ask, so how can I get my child? Of course, my response is, that would be good if I can have directly, I can be directly interacting with your child to see what is going on. But I would say that's not necessarily the case. Sometimes parents have a lot of questions. And then, or I would say sometimes parents already know certain answer, but they want to have more clarity. So they can themselves come to the assessment just to assess. They might be able to show some videos, for example, or some kinds of evidences, like a teacher takes some picture or my child's schoolworks and so on. I think even just with parents itself, the assessment, that can be quite helpful. Of course, eventually, if that's possible, I will work with parents that, okay, let's try and see how can we get your child, come to the session eventually. And then we actually have a more accurate assessment on your child behavior. But if, let's say at the current stage, if your child is not really ready for whatever reasons, or it's very hard for your child to get up to the car and so on, then definitely we can come and then we can have the preliminary assessment. So probably you can show me some videos, how your child typically behave at homes and so on, or you bring in the questions that you want to be answered. And then it can be from the consultations, I can already advise some things. Like, let's start from small, for example. Okay, probably the way you talk to the child can be adjusted and so on. And let's work step by step, to get the child comfortable assessment. Yeah, not necessarily have to be, my child is not ready. Wait until my child ready, only we come for assessment. I would say a lot of time that would be, a potential delay. I would say child forever won't be ready. It's like child, they're actually quite scared to see a doctor. It's the same thing, right? So it's like, mommy, bring you go to see a psychologist. So they might not be at the stage of understanding how psychology works. To them, it's like, it can be quite frightening and so on. Yeah, it's a matter of, to get your answer. To get your answer from a professional, like a providers. From there you can actually gain a lot of insight.
So it's not only a matter of whether a child can undergo a full psychological assessment, such as what we discussed earlier, where there is observation of the child, history taking, standardized assessments. But beyond that, there's also psychological consultations in order to educate the parents, or perhaps to gather whatever information that can be available and to provide the appropriate support or advice given the circumstances. So it's not only in the context of when you think of psychological assessments, these are the steps, but if there are certain limiting factors, doesn't hurt to actually come for an appointment as well. So there's, I think, a few layers to what the services will entail. But nevertheless, if parents, for example, are curious about their child's development, are thinking about how they can best support their child, or if there are certain signs that the child may be having certain concerns in terms of their development, in terms of their ability to adjust at school, then those can be potential reasons why they're coming in as well. So really varied reasons why a parent may choose to come, but nevertheless, parents choose to come for the best interest of their child. So I think that will be a more general trend or general theme to consider as to when to approach these kind of services. So let's say a parent has signed up for a full psychological assessment. We know that the child will undergo, the standardized assessments, and then after that, a psychological report will be provided. Other times, it's going to be more of a consultation setting where the parents perhaps could be briefed or could be advised accordingly on what can be done at home. Would there be any other methods of working with a child aside from these two? So consultation with parents, or maybe with the child, or we complete an assessment and there's a report. Would there be a case where the psychologist might need to work with teachers or with other professionals? Are there such other ways of working as well?
Okay, so to answer your questions, I always believe that it takes the whole village to help a child. Yeah, so not just parents, not just the child themselves, but of course school, and of course if there's a need, sometimes we might involve some other professional. For example, speech therapists, occupational therapists, or even a child developmental pediatricians. So a lot of times the kids come to us, they might already gone through some sort of pre-assessment by their pediatricians, or they might went through some kind of child developmental pediatricians kind of assessment, and they're monitoring for, let's say, symptoms for like autism or some psychological like childhood depressions or whatever and so on. So I would say because a child's being in different environment, like for example, spend maybe like quarter of times in the school, and then another quarter of times in daycare, for example, and then at night maybe with the parents. So I believe that closely working with different, not just a life health professional, but different parties, like the child environment is very important to support the child growth. So starting from the initial assessment stage, there will be times that we might need to make appointments or calls with a teacher just to understand the child further. So for example, even during the basic assessment, then you feel like, okay, there's something missing there. So for example, ask a parent, so how is the child functioning in the school? Which is usually is very important. But sometimes parents say, I'm not very sure. Teachers are usually quite busy, I don't get a chance to talk to teachers and so on. In that case, of course, we can't directly approach the teacher because we technically as a third party, but we will ask the parents' help to be the middle person. So probably, you can just let the teacher know, I would like to have words with her. So, and then let's set up an appointment, maybe a 15-minute course and so on. But of course, moving forward, so let's say we complete the full assessment, right? So we gather the information. So all this are just to gather information about the child functionings and everything. And the steps forward. And a lot of time also, even with the aftercare plan, there are times that me, I also need to personally work with the child for intervention. So for me, I will be mainly working on emotional and behavioral challenges, depending on the child's situations. So of course, sometimes I might need to work with speech therapists. So speech therapists, their strength is not just about speech, but basically it's anything related to social and communication. So for example, today I want to maintain eye contact. Right. So why I need to maintain eye contact? Because I want you to pay attention. So the functions of communication, of course, these are beyond my expertise, right? Of course, I can be working with you through different play techniques, different expressing methods for the child to be able to express itself, understanding emotions and so on. But I wouldn't be able to teach the kids the skill. How can we maintain eye contact? Or how can we pronounce certain words, for example? So these are some things that I might need to work with speech therapy. And occupational therapy sometimes can be very helpful when it comes to sensory overloads and emotional regulation. So sometimes parents might overlook that, my child, why is it he's being so active? Very impulsive. He loves water. So he saw there's a swimming pool. He would just let go my hand. He would just run all the way, to the swimming pool. Of course, as a psychologist, the things I can work with the kids is, we can teach the kids how to pause, how to manage the impulse. But of course, I understand that for children, it can be a little bit complicated as compared to adults, as a lot of times children also have some sensory regulation problem. So it's like, for example, today we are in a meeting. We find the meeting is so boring. So we know how to cope with it. For example, we shake our leg, we play with pens and so on. We as an adult, we know different ways how to cope with our, sensory challenges and so on. But for children, they don't know the way. And this is also beyond the psychological expertise to teach them what's the correct way to do. So a lot of time I might need the occupation therapy helps to help them to address those challenges. And of course, if there's some motor skill problems and so on. And of course, school. Yeah. So sometimes what has been reinforcing a child behavior, for example, or a child struggle, it could be the school environment. Of course, I'm not saying that it's the school fault or teacher fault. Because a lot of time they have to handle a big group of children and they might not know the skill as well. Yeah. So a lot of time I might be working with the teacher. So we schedule a regular feedback sessions and so on, just to develop a plan. So how can we support the child better in the inclusion setting? Is there any accommodations that we can do to help the child to thrive, in the right condition and so on? So it's very important if we talk about not just assessment, but moving forward, the collaborations of the different parties in the children's life is very important to determine if the child can actually function independently across different settings.
Right. So in order to answer to this, I think the audience back home needs to understand that the role of a psychologist can be narrow and specific. So in a mental health assessment, we are assessing for the person's psychological functioning. Of course, psychological functioning doesn't happen in a silo. They are in an environment, whether at home or at school. And there's also physical development of the individual, especially with children. They develop quite rapidly in childhood years. They're not yet adults. So all this has to be taken into consideration as well. After the assessment is done, noting that there's areas of improvement or perhaps strength, the psychologist will be able to provide further intervention in terms of emotional as well as behavioral regulation. What can be done in terms of addressing certain emotional difficulties or behavioral difficulties that the child may be having. But at the same time, other people will need to play their roles as well. So the child is going to school, so the school environment is going to be important. The teachers will need to play their role. There's certain aspects about the child's physical development that requires support as well. So you've mentioned about speech therapists, occupational therapists, they might be targeting different areas of development where psychologists will not be able to assist with. So as much as a psychologist provides the assessment, but in terms of the follow-up recommendations, it might not even be psychological intervention at all. It might just be, for example, certain parent coaching where certain changes at home needs to happen, and then the child can generally thrive already. Or perhaps it's a school issue, right? A very specific isolated case where the child may be being bullied at school. then therefore I think there's more practical considerations that need to take place in terms of school arrangements and whatnot. So it doesn't necessarily mean that a psychologist will be needed all the way. Sometimes it may be needed, sometimes not. But if parents are curious, if parents are concerned about their child's development, meeting with a psychologist for an assessment is definitely beneficial. Now, as we come to the end of our segment, I think we could end, we've I think talked about a variety of different areas with regards to assessment, pretty comprehensive. But if, let's say, the listener back home is considering a psychological assessment, what would be, as a closing to our episode, some words of advice or encouragement that you can provide to the parents for them to, perhaps be more informed, or perhaps for them to begin taking that first step towards their child's psychological needs?
I remember there was once I seen I think a quote. So, I like the quote a lot. So basically you're saying that, assessment is not putting a child in a box, but it's open the path forward. I think that is a very good summary, of all our discussions today. So I would say children's, they have a golden period, right? So to invest in assessment is actually a long-term investment. So once you invest, and then sometimes you might not know. But I would say once you open, you make the first steps, it can be a very rewarding journey. Yeah. I would say as a clinical psychologist, a lot of time they play a case manager role kind of thing. Yeah. So of course the first step maybe start with a psychologist. So do all the assessment, everything. And after the assessment complete, we might need to work with different parties. You might go to SD, you might go to the occupational therapies and so on. But eventually, we will need to know, is my child improving? What will be the next step? So, okay, right now I'm already meet my initial goal. So my child can achieve, a certain level. But what would be the next? It would be lovely to know what is my child potential and so on. Then you can always go back to the psychologist. Then we can schedule follow-up assessments and so on. I would say that is a very valuable investment. Yeah, even though sometimes it can be costly because it takes a lot of, time, effort, to, for example, gather all the informations and do all the scorings and so on. But definitely it's worth. And do not, how should I put it? So basically, once you have started to have some questions, don't hesitate. So you are not being overthinking. Once you have the questions, go and seek it out for the answer. Right? So who knows, the answer can help you or your child to try further, in their life.
So I hope that the discussion today can open up those options for the parents, that psychological assessments aren't only have a very narrow scope of diagnosis, but rather our discussion also highlights the various benefits that the child or the parents can receive, and the different methods to which an assessment can happen, whether formally or informally. And that it is more for not only in terms of assessing for diagnosis, but in terms of knowing more of what can the child benefit from, or in terms of what can allow the child to thrive more. So I hope that our discussion today will be able to sort of expand on perhaps initial assumptions of what a psychological assessment is. So Ewin, I think we've come to the time of our end of our episode, and thank you for coming today.
Thank you, Ewin, for having me here.
Thank you for tuning in to this episode of Be Kind to Your Mind. Found this content educational? Hit the subscribe button to stay updated on new episodes every 2 weeks. See you soon.